My title is Director of Patient Safety Risk Management. I'm also the Administrative Director of Infection Prevention and Control. So when I introduce myself at new employee orientation, I say, I sort of run the gamut. When things go bad, I'm there to support you. I'm there to help the organization learn and understand what happened, and then create a liaison with the judicial system if that's required. But then we're also going to take everything we know about the things that have gone bad and translate them to the patient safety side and very proactively try and figure out what can we do different from the start.
Faye and Camille are both inspiring leaders. They both advocate very strongly for patients and families, but at the same time they have a great deal of respect for the people who provide care and the ability to bring those people along effectively on the journey towards doing what's the very best thing for patients, residents, and their families.
She's always committed to the patient, and she never forgets she's in healthcare. The fact that she's a lawyer is wonderful, but she also has many years of clinical experience as a nurse, and that really comes through in the decisions that she makes in the work she does.
Camille is so great. She says what needs to be said, not unlike Faye Meuser herself. Faye always, she said what needed to be said. She was very frank, and Camille does that sometimes too. And also like Faye, she has a sense of humor. I appreciate that.
What I think makes a good leader is someone who can lead by example, someone who can demonstrate commitment, passion, perseverance, humor, engagement, caring.
People will, because they trust her, they generally will do follow her and look to her leadership on many fronts, particularly some of the most difficult situations we find ourselves in.
Well, it was a particularly difficult situation which involved a community partner. Actually, it was a patient showing up in our emergency, and people were very upset in the emergency, in the surgery, on the units where the patient ended up, about what the patient had experienced in the place they were coming from. And she just kind of brought us all back and said, let's step back, let's look at this with an open mind and an open heart before we rush to judgment about what happened.
I have to find the language to be honest, truthful, tactful, compassionate when I'm talking about things that are really quite bad sometimes.
She doesn't suffer fools. But if somebody needs her assistance, a colleague, a leader, or a staff member, she's right there for them. And with Camille, it doesn't seem to matter whether it's 6 o'clock in the morning or 8 o'clock at night, she'll be there.
I asked for a suggestion on how to deal with a kind of challenging colleague at another organization, and her reply to me was, suck it up, Buttercup.
Forward, back, side together, side, back.
Camille can go from a really tough meeting where everybody's in tears and it just completely wrenching and draining, and then go out and teach a dance class and teach us all to dance.
I don't even know why I got the idea that we would pull together a dance corps. We spent about 4 months rehearsing here with a team of people, and it was just, a fun escape, a great opportunity to meet some different people. I personally think that dance is such a creative expression, and it is a good stress reliever, and I was happy that I found people who felt the same way.
We're so privileged to have her here at Providence Health Care. Anybody would want Camille.
When I took this job, actually probably back when I first went to law school, my colleagues all said to me, oh, with the combination of your backgrounds, nursing and law, there's going to be a perfect job out there for you somewhere. And I thought I'd found it when I was doing, private practice, medical malpractice defense. I didn't know what a perfect job was until I came here.